Hello and welcome to Crushing Doubts Q&A every Monday, 6 p.m. Eastern, 3 p.m. Pacific. We're a couple minutes late today. There's always some technical issues that can pop up here and there. But here we are. We're ready to go for some more mind-body questions. I'm here, of course, on YouTube. I'm here on Instagram, on Facebook. So let the questions fly. As you know, my theory is that we've got to get our questions asked and answered. So please do jump in with whatever questions you have. We usually do start with at least one preloaded question. Sometimes we don't get to any others because you guys start jumping in. But I do want to say one quick announcement. We are in the second week of my membership groups. I'm really excited about them. They give another way that people can interact with me as needed. I talk all the time about how this is moment-to-moment work. We need to think about how do we make each moment work? How do we interpret each moment? Well, the membership groups are another way that you can do that. If you're interested in getting a link to that, please send me an email at dan@crushingdoubt.org or send Greg, who actually handles that sort of thing even more and might get back to you even quicker on that, greg@crushingdoubt.org, and we can get you set up or answer any questions for you as needed. Our next seminar is coming up December 6th. That is Monday, December 6th. That'll be the last seminar of the year, so please do jump in as needed. Now, we actually do have some questions coming in, so maybe we won't get to a preloaded question just yet, but I will have it loaded up soon. Dorisa, I see you saying hi on YouTube. Joni Miller with a thumbs up. And that may have been in response to Tyler Hathaway's question, which I'm about to read now. Okay, Tyler has a two-part question. Let's see if we can get it loaded into one on the screen. Looks like we should be able to. He says, hi, Dan. How effective can painkillers be with TMS-based pain anyway? Wouldn't the mind want to just ratchet the pain back to its original level, since that was the original intention and the brain has the power? Maybe I shouldn't be asking because of placebo. A wink. So this is an interesting question, one that I would say is still evolving in my mind as I think things through. I've had a lot of experience with medications, positive and negative, that can relate to mind-body aspects. Now, what I will say is that painkillers, sometimes people feel the need to use them, and sometimes it's pretty warranted. Let's say after you've had an actual surgery, that's going to hurt a lot, and you may want to use some kind of painkillers. However, I have found that just Advil is good enough for almost anything. However, does that work with mind-body conditions? And that's really the heart of Tyler's question. I would say this. It all depends on your belief system. Ironically, you can take painkillers or not, but even if you take them and you don't believe that they're going to help you, they won't. And if you do believe that they're going to help you, you can get results even when it is a mind-body condition. Because remember this, the mind-body condition is interested in the long term. It's interested in its own ability to function. So it doesn't want to expose itself at any point in time when it doesn't have to. If you are, let's say, taking a medication and it's supposed to help, it'll allow that. It knows that it can just come back later. Essentially, another way of thinking about it, Tyler, is that it's already achieved the distraction. Now you're thinking physically anyway, and that's what it wanted. So let me know if that answered your question, and we'll take it from there. Molly Cake said, I do not think painkillers are good. It's just a Band-Aid in my opinion. That's certainly the case, Molly. I'll back you up on that in the long run, they're not doing any good. And in fact, I've been consulting with various people on this to try to get this noticed in a number of different areas, but the opioid epidemic really would be resolved most effectively if we bring in mind-body understanding and get that to a good place. And I believe we are going to do that. It's only a matter of time, but we got to work at it. And in that way, yes, I agree. Not only is it a Band-Aid, it's a Band-Aid that can lead to addiction and other problems. So it's a pretty dangerous Band-Aid. Okay, we've got a comment coming in from Talia now. She says, hi, Dan. How do you handle TMS fibromyalgia type symptoms, such as fatigue, heavy muscles, brain fog, and dizziness, especially as supplements can ease symptoms? Okay, Talia, I might need some... sorry. I see you have a follow-up to that. Let's leave this up here, Courtney, but I want to read the second half of the question anyway. Supplements don't cure symptoms, and I'm trying not to use them now. I understand TMS better. I'm good at understanding. Okay, so here's the thing. She said, I'm good at understanding pain as mind-body, but not so much fatigue. Okay, so Talia, this is a very common experience that people have. And some of it is because so much of the mind-body world is focused around pain. And in specific, it's focused around back pain more than anything. And the reality is it will be much more helpful to us if we can broaden that. If we can broaden the perspective so that we know that all symptoms operate the same way. Here's the way I think about it. If the body's already capable of doing it, and we know that the mind can co-opt bodily experiences, why couldn't it co-opt other symptoms in the exact same way? So what I want you to do, Talia, is to start to think about these other symptoms, fibromyalgia, brain fog, dizziness. Try to think of them just the same. Looks like we're having some problems on Instagram. Well, hopefully that'll come in better. There we go. I think we're back on Instagram. Sorry for the interruption there. And Susie, I see you there. Jasper, I see you there. And Lucy's joined us on Instagram as well. Good to see you all. So what I was saying is that I want you all to start thinking of each symptom the same in terms of the mind-body interaction. I was just talking to somebody about this in my membership group today. Peptides are so key to me and to many people in understanding how this can work. The brain has this one mechanism of controlling every cell in your body in whatever system it wants based on whatever it needs to do. And that is by sending these messengers called peptides, which you can read about in the book Molecules of Emotion if you need to know the specifics about it. But these are basically like neurotransmitters, but they go in the bloodstream. They can communicate to any cell in the body and tell it to do anything. So it could say, you know what, I'm going to make your muscles feel heavy, or I'm going to give you some dizziness, or I'm going to make you feel fatigue. And the body follows suit. The body's going to do what the mind tells it to do. So the thing that we need to help you do, Talia, is to break through the doubt and start to think about these symptoms as absolutely no different than pain. Absolutely no different than everyday mind-body experience, like crying or blushing. It's all the same, but we have been fed so many different messages on this that we don't think of it that way. So when you say, how do you handle TMS symptoms such as this? I think that we really need to treat them the same. Now, you do have a follow-up question, so I'm going to get to that, and then I'll move on to the next question. But Talia then says, yes, I do understand the fibromyalgia and POTS as the same, but don't seem to be good at shrugging them off. Pain, I seem to be able to shrug off. The peptides explanation helps. Good, Talia. I'm glad that helps, but one thing I want to help even more with is to explain why you can't shrug those off. Okay? Now, here's one way that I differ from some other mind-body practitioners. I think shrugging off the symptoms sometimes can be a good thing, but it's not always the answer. Sometimes indifference isn't really achievable because maybe the terror is too high or the discomfort is too high. What I want you to do instead of shrugging it off is to do battle with it in the arena of doubt. I want you to raise those doubts to consciousness. Articulate the doubts very specifically. So you can say to yourself, well, why do I think fibromyalgia is so much different than these other things? Actually ask that question and investigate it. So I'm not recommending just shrugging it off. Let's really dig in there. Okay? And let me know if that helps. Okay. Now, Molly was commenting on the painkiller discussion. She says, however, I'm not against a nice glass of wine. Then Joni Miller weighed in. Good to see you here, Joni. Opioids only worked for me for a little while. I agree, Molly, on the wine, LOL. Okay, now Molly says opioids are just scary and are super dangerous. Plus, it basically is a drug like heroin. Yeah, look, I mean, painkillers, I think you mostly don't want to mess around with those at all. I understand after like a surgery, you might need that for, the first number of hours. After that, I think it's better to take painkillers that aren't opioids, that don't have addictive qualities, not just because of addiction, but, well, that is a major reason, but it also makes the whole situation very confusing. The sooner you can get down to a level of just using some painkillers just to dull the pain a little bit to help you through, you're in better shape because then it doesn't get into doubt. I'm very protective of you all about how doubt can come creeping in. And opioids not only are addictive, but they also are very, very bad for doubt. So let's talk more about it. Now, Tyler has a follow-up to this. He says, so, when you say painkillers' effectiveness depends on your belief system, then that sounds like placebo, basically. Is that accurate? Then I wonder, how do I delude myself into making it work? LOL. Also, is ibuprofen also good along with Advil? Okay, so actually, Advil is just the brand name of ibuprofen, so they really are the same. And you can use them in combination, but it really is just the same medication being used. So it would just be increasing the dosage. But I find that some people are better at deluding themselves than others. I'm very, very bad at deluding myself. And I say that with some pride and also some jealousy. Speaking of what Tyler's saying here, we would like it to work. I actually found that I used to take Advil with my 8 years of back pain. I used to take it, and that was the time during the day when I would take Advil that I would get relief. Since I've discovered the mind-body process, I have no chronic back pain, but Advil barely works for me at all. And sometimes it's really about what you know. The good news is we don't actually need painkillers. What we need is the ability for the body to shut off the pain response. And the columns really allow us to do that. I want to back up for a sec because Tyler was asking, isn't saying painkillers' effectiveness depends on your belief system. Isn't that placebo? Yes, essentially that is what I'm saying, but that's only part of the equation. It is a biological thing to put these things in your body. You can have a big effect, but it can be mitigated by your belief system quite a bit. Unfortunately, we usually can't control our belief system with much but information. If we use information and it's really solid and we feel really good about it, then yes, we can get there. Okay, Talia says, thanks so much for your help. I only just discovered your channel. You are wonderful. Oh, thank you, Talia. Then she said, brilliant. I don't know if you were talking to me, Talia, but if you were, thank you. If not, we will get that assigned to the right person. Scotty Styles has joined us on Instagram. He says, hey, good to see you, Scotty. Now we have a question. Oh, Betty also joined us, and so did Michelle on Instagram. Good to see you guys. Jasper has a question coming in from Instagram. We're going to get to that, and then I will jump back to YouTube. And if you do have questions coming in from Facebook, let me know. Jasper said, I had a rehearsal the other day, which I got through. Jasper is an oboist, which I found out from listening to him that playing the oboe is one of the harder instruments to play for a number of reasons, including the creating of reeds. But I'll let him speak to that. In any case, he said, I had a rehearsal the other day, which I got through. However, the next day I had residual pain and my TMJ came back. So pain in his jaw. Any ideas why I hurt after doing the thing that causes my mind to create the pain? Okay, so Jasper, this is what I would call a trigger, but I think what part of what you're asking is, why was there a delay? Now, the thing is, pain's going to come in whenever one of these columns gets activated. So I would say that for whatever reason, you didn't need any kind of activation of something. Your mind wasn't really looking for the mind-body response yet. But when it went looking for a reason, it remembered that you had done this rehearsal, and it attached to a semi-plausible motion that you had engaged in. Now, if we think about it, it's pretty ridiculous. Should have hurt right away. But even if it's semi-plausible, then it can evoke some doubt. So I think that what it speaks to is you didn't need the symptom until later, and when you did, it went looking for something that seemed to make some sense. Jasper, let me know if that makes sense to you. Lucy Jane, I see you on Instagram. Thank you for joining us. We have an observation from Bob on YouTube. He says, every symptom, hundreds, unless physical trauma or disease, could be considered mind-body. Absolutely, 100%. The way I think about it is, now, of course, you want to go to a doctor to rule out anything life or death, but beyond that, from head to toe, every symptom you could ever have can be co-opted by the mind-body experience. Bob, I love to hear this from you because I've been tracking you some as you made some comments on YouTube. We've had some interactions in various places, and I know that your confidence is growing in this. You're seeing results, And that's what we do. We take our successes and we build on it. And eventually you get to, pieces of information like what Bob's saying that he can use for good self-talk to himself. That gives him the opportunity to break through doubt. We keep getting more information. We keep becoming more convinced, more convergent material until it's pretty hard for doubt to have much room to move. Okay, I see we've got a question on Instagram from Catherine. I'm going to get to you in a second. First, I'm going to get to Liamo 54321. Okay. Hi, Dan. I've had this symptom where my abdomen muscles are super tight. Started one area off the abdomen, then spread all over my abdomen over years. But it's there 24/7, never eased up once. What's the best way to tackle it? Also, is a symptom that is there 24/7, Also, is a symptom that is there 24/7, never eased up once, only getting worse, etc.? Is that a sign it's strong trauma? Okay, let's leave this up there because there's a couple questions in there. First of all, the best way to tackle any of these problems is first to locate which column are you working in. Now, if this is a condition that has never really changed and doctors have cleared you of anything worrisome, which I can't imagine what it would be in the abdomen muscles, then we are talking about the doubt column. So the easiest way to tackle this, or the best way to tackle it, is to start to really do the doubt column work. You need to articulate the doubts. This is what's really important. I think it's Liam. Articulate these doubts. Find out what they are. Maybe you're thinking, maybe I had an injury and now it's spreading. Now, by the way, when I say these to you, don't use these as doubt. These are theoretical things that are wrong. So don't grab them. I'm not suggesting they're right. They are completely wrong. But I'm giving you examples of wrongness. You could also think, maybe the tension started and I'm never going to be able to get relaxation. Liam says that his doctor checked him. He's all fine. So good. We can work on that. So what you want to do is articulate the very specific doubts you're having there. Why do you think it hasn't eased up? Now, I can give you my answer. The reason it hasn't eased up at all is doubt. What's the reason that it seems to be getting worse? It's actually not a sign that it's strong trauma. You may have had strong trauma, and we can look at that. But the reality is this all is when it gets worse, it just means doubt has gone up. Your symptoms are a measurement of the columns. If they're going up, the activity in the columns is getting bigger, and we just need to find out why. The good news is it doesn't mean anything in terms of you being doomed or not being clear that you're going to be okay. It's all about the interpretation. When I hear about a symptom that hasn't budged, I go straight to the doubt column. When I hear that it's getting worse, I know the doubt is going up. So all we need to do is articulate that doubt and slam it. We'll use science and logic, and we'll do it together. Now, Liam did say, also, I just recently found your page very good. Glad to hear it, Liam. Thank you for the vote of confidence. And please do let me know if I answered your question well enough. As a starting point, we can follow up as needed. We got a question on Instagram. We actually have a couple, so I'm going to get to that. Catherine Toomer says, "Hi, Dr. Dan. I'm gradually getting to know your whole mind-body thing better and being benefited. Thank you." You are welcome. I'm glad to hear it. Question. I have a young friend in his 30s who underwent extensive surgery due to, hold on a second, it says due to can, but then it runs out. So I don't know what the question is. Catherine, can you continue that question? Let me see if I missed that. Okay. I think there might have been a limit in what you were able to type, Catherine. So type in the second half of that, and I will get back to you on your question, okay? All right. I see Sue Conte is here. Good to see you. All right. Scotty Styles from Instagram says, I'm still working through foot pain. I have a bit of a shift today after letting out a burst of sad emotion today. I hope I can make this stick, quote unquote. What is a good way to reinforce the pain as emotion? Okay, Scotty. Interestingly, one of the things that I hear in your question is that there's doubt underneath. When you say, I hope I can make this stick, another way of translating that is, I'm worried it won't stick. That's a doubt column thing. I suspect that you are doing, and I don't mean this as criticism, just as a pointer. I think that you are, and I know, from interactions that you're doing good work in a variety of ways, but I think you may be doing too much work in the emotions column here. And I want you to slide over to the doubt column, because underneath it all is doubt as a primary thing. I just did a membership meeting where we talked about how do you locate which column is the driving force behind things. In this case, Scotty, and I'm happy to tell you all these things as we go, but in this case, I'm hearing that the doubt column is more primary. You're looking through emotions, but you're having doubts there the whole time. So move over to doubt, articulate those doubts, and let's get you to a place where you're more confident that really, when it comes to work in the emotions column, it's not actually going to be that hard. It will always stick. The only worry that it won't stick comes in the doubt column. And that's why when I hear that, I say, hey, shift over to that. Scotty, let me know if that makes sense to you. And let me make sure there's no follow-up that you said. You did say last time you mentioned to continue to tackle the doubt, and I know that has helped too. Okay, so I am, I guess, doubling down on that because I think it's really important that you recognize that doubt is the driving force here. So let's start with that, and I want you to follow up, ask me questions as needed to see if you need more answers than that. But really, I hope I can make this stick. Screams doubt to me. I understand it, but I want you to take a good look at that, get it articulated, and let's answer it with science and logic. Okay, back to Catherine's question. She said, here it is. I have a young friend in his 30s who underwent extensive surgery due to cancer. He had to have a colostomy, etc. 12 years later, he has bad leg pain. Can't walk well, has muscle atrophy. Doctors did a surgery on his knee, no help. Now just meds. Couldn't this be mind-body? Okay. Now, listen, I think that with respect to cancer and things like that, I defer to doctors on the life or death part of that experience. From the sounds of it, they were able to take the cancer out. It's 12 years later, so presumably he's in remission, no cancer active there. As long as he does not have a major medical condition going on, the idea that this could be mind-body is actually quite likely. Now, think about it this way. Your mind causes symptoms when you're upset about even little things. It causes symptoms when you have doubts of any kind. It causes symptoms if you're not in your power. Would it be possible for it to cause symptoms when you suffered through cancer, have a colostomy bag, have suffered for years, continue to have pain, and probably, I'm going on a limb here because I don't know, but probably have a lot of unprocessed trauma, because everything you're describing in that description, Catherine, does speak to some unprocessed trauma. I think it's likely that this is mind-body. Very much so. I think beyond that, even if it's maybe there is something going on related to some medical condition, a huge portion of this is mind-body no matter what. Okay, so Catherine confirmed, yes, in remission, no cancer. So this is mind-body almost certainly. Mind-body conditions are the dominant force in our lives when it comes to physicality. So, Catherine, let me know if I answered that question to your satisfaction. Please get back to me. Okay, Edgar Rivera has joined us. He's my co-host on Brothers in Arms. Edgar, great to see you. He says, yo, 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 what's up, Doc? That's the beginning of our show. Always starts with yo, yo, yo. Great to see you, Edgar. Thanks for joining us here. Okay, Scotty, as a follow-up, said, wow, thank you. Knowing it screams doubt is exactly what I want to hear. It really does, Scotty. That's all doubt. Now, I think I may have missed something in this feed. Jasper was giving a follow-up, and he said, yes, I need to process what you said. Why the added location of pain, something wanting attention emotionally? It's unclear, Jasper, in terms of why it added that location of pain. But here's what I'll say. Doubt is always looking for places to reside. It's looking to almost source problems. It wants to find places to rest. So I would say, why wouldn't it do that? Any motion that you do can potentially be a trigger that doubt is waiting to pounce on. And I say we've got to look for those very carefully to really pounce on them. Keep on top of doubt. Remember, I say doubt is always going to try to come back in. This is a way that it did. In fact, look, it worked. It's gotten you asking questions. It's gotten you confused. That is the design of it. I'm not blaming you, of course, Jasper. That makes perfect sense. But look at what it's doing. If doubt is getting you confused and asking questions again, it's made a tiny gain. And that's what it wanted to do. Okay, back to some YouTube questions. Let's see. Molly, back on medications, she said, be careful with ibuprofens too. Can lead to kidney failure and or ulcers. Do not overuse it. Yep. Personally, I never take painkillers. I would rather suffer through a headache. So it really is true. When I had to get off Advil, which I was taking for a long time, they don't talk about it like it can be a danger. And I remember thinking, why weren't people telling me these things? Well, it is amazing what people are not telling us. We're getting all kinds of really bad information. So listen, I don't want you to be afraid to use ibuprofen when you need to, but I agree with Molly. You don't want to be using it regularly. It can be of danger in that way. And in the meantime, you don't need to. If you use these columns right, we can get to a place where you don't need those at all. Painkillers or ibuprofen. Painkillers you don't need at all. Okay, Molly. Oh, hold on. Okay, sorry. Got distracted. I was trying to figure out which question was which. Okay, we have a follow-up from Catherine, and then I'm going to get to a question that Molly's asking on YouTube. Catherine says, follow up on the friend. My friend did great for years, got married, had 2 kids, good work. Then the pain came. Doctors don't seem to know how to help him now. Yes, your response, very, very helpful. Okay, glad to hear it. So, Catherine, from the way this is, the profile sounds, it sounds to me like he had a lot of unprocessed trauma that probably contributed to the cancer. That's not his fault, but that's one of the risk factors. I'm not saying it caused it, but it could have been a risk factor. Whether it was or not, the cancer and whatever that operation would not be the cause of this kind of pain. This is all speaking very much in line with how symptoms work. My guess is some emotions column process began now, or some doubt process got fired up, or a power column issue came up. I mean, when it comes down to it, there's only 3 columns. Look in the 3 columns. We can find where it is. But I can guarantee you from what you're describing, this is a mind-body issue. Unless there's some undiscovered major medical condition, he should get checked out to be sure. But beyond that, I feel very confident this is a mind-body thing. Okay, I see Liam822 has joined on Instagram, and so has Good Enough Housewife. Good to see you. I think somebody else did. Oh, okay. All right, over to Molly's question on YouTube. She says, is pain linked with guilt too? I know when I would get the flu, I felt guilt and never understood why. Fascinating. Okay, Molly. So this is a great question for multiple reasons, but one of them is that it's just really interesting in terms of how it might relate to specifics. One thing that I do like to kind of clue people into is that even though the columns work the same for everybody generally, they're going to work differently for each person in specific. So pain absolutely can be linked to guilt. No question. Guilt is a big feeling. Remember, in the emotions column, for example, pain can come, or symptoms can come, from anything that is high stakes or a big theme. Well, guilt fits the picture. So is it linked with guilt too? Absolutely. But it's going to be for some more than others. That can be activated in the power column as well. Some people start to get powerful and they start to get guilty, or they start to get worried. Now remember, guilt and worry, 2 totally different things, but there can be big emotions. So I'm interested in this observation you make. I know when I would get the flu, I felt guilt and never understood why. So here's what I say to that. I don't understand why either, but I do think that we can get to the bottom of it. So let's ask the question. This is the way that I would engage about this, as I would with any symptom. Let's ask the question, why would you feel guilty for getting the flu? Don't know the answer to that, but try to answer it, Molly, and let's get back to me on it. Let's see where it goes from there. Okay? All right. Joni Miller had an observation. I even had swelling in my fingers when I was having my worst TMS symptoms and stress. I was amazed about it. Yeah, listen, anything can happen. Anything that the body is capable of doing, it can happen for mind-body reasons. I had one of my very first patients after I recovered from back pain and I started doing this work. She, you actually can see her on the YouTube or listen to her on Apple Podcasts or Spotify and all the other sources of our audio podcast. She talks about the fact that she talked to me about a symptom she was having that we actually did kind of laugh at, because it was so absurd. She had very, very swollen ankles, and she called them her emotional cankles. Anything can happen, and we were blown away by that too. So Joni, I think, is voicing something that's kind of important here where we can get very surprised. Wow, it can even do that? Yes, it can. People can have their hair fall out. I've seen people with, their eyebrows fell out from this. I've seen people with blurred vision and snowy vision. And I've seen people with vertigo. I mean, if I just think head to toe, I can just go through, okay, tinnitus and pain in the jaw and tooth pain and neck pain and rib cage pain and shoulder pain and elbow pain. And we can just go on and on and on. Skin sensitivity, rashes. You just keep going down the list and down the body, and you can check off any symptom you could have can be a mind-body symptom. It even can be the case that some of these symptoms are mind-body even when there is a major medical condition. Major medical conditions need to be treated by doctors. We have to be very careful about that. Absolutely. But sometimes symptomatology can come out just from the feelings we're having. And it's very interesting to me. Why would people think that somebody with cancer wouldn't have feelings? Of course, they'd almost be more likely to have mind-body symptoms because they're going through something big. So I think we need to stop ruling. We have to stop deciding that mind-body symptoms are over here and medical things are over here. Medical things need to be treated medically. I'm absolutely 100% all for that. But that doesn't mean that mind-body symptoms can't also happen. We shouldn't be thinking of them as either or necessarily. Now, it is the case, though, that there's going to be many, many times where you're going to have mind-body symptoms and nothing's happening medically. But we need a doctor to clear that. Okay. Liam's asking some questions about what I do and what I offer. He says, where can I find the columns of doubt, please? Also, do you do one-on-one sessions, make an appointment with you if possible? So, all right, here's the thing. The columns, you can get my mind-body guides or the PDFs on our website, which is www.crushingdoubt.org. I also am working on my book. I'll get that to you as fast as possible, but there's been so much work that it really is delaying things. I will get to it, I swear. I'm getting closer. I made some more progress this weekend. In terms of one-on-one sessions, there is a long wait list for it, unfortunately. But the upside of that is whenever I run into any problem, including in my own ability to help people, I invent new things. This is part of why I've invented, first, the seminars. The seminars are a way to give you all that information all at once. It's 8 sessions. It gives you every scrap of mind-body information you need. It combs through the whole mind-body community experience and how to think about it. And that is incredibly important. What I've also come to see is that this is much better for one-on-one sessions to have done the seminar. And as such, I now make it a requirement that if you're going to see me one-on-one, you take the seminar first. It's a world of difference. I can put you in touch with somebody who's taken the seminar and then done one-on-one sessions, and they can tell you, wow, I can't even imagine what it would have been like. So, Liam, first step is the seminars. I do have the membership group, though, which is another way to kind of check out things if you want. And it's also a way to do very affordable follow-up to the seminars, which was another part of the system I had to build. So you can contact me, dan@crushingdoubt.org, to talk about these options, and we can figure it out from there. Okay, we have a question from Shannon Perryman. Then I see Good Enough Housewife on Instagram. I will get to that too. Shannon says, if we haven't started your work, would a membership be the best place to start? All right, Shannon. That's a good question. I'm still kind of thinking some of this through in terms of, like, this is the first time I've had the membership before a seminar. So I actually have to ask the question, would it actually make sense for you to start the membership group and then do the seminar? So actually, what I think is the best place to start is to sign up for that seminar, but that doesn't mean you have to wait. You could sign up for the seminar and start coming to the groups, start getting some exposure to this and some information on it. So there really isn't a right or wrong way to do it. But Jasper just said, agreed, seminar is great for column education. And Jasper has been to the seminar, so he's somebody that can speak to it with a lot of authority. We can put you in touch with people who have been through it to get a sense of that. But Shannon, I would say book your seminar. That's the number one thing that I want you to do. The seminar is incredibly important as common ground information that makes everything easier. That being said, if you sign up for the membership, you actually get a discount on the seminar. So they do go hand in hand. It's okay to me to start working in the membership groups and then do the seminar. That's okay. The one-on-ones, you got to do the seminar first for sure. And there's going to be a wait list for the one-on-ones anyway. There's not a wait list for the membership group. You can join right now. Our next meeting is Wednesday. So if you really want to get to work on it, don't wait. But I would say factor in the seminar. It's really, really good and important. Okay. Good Enough Housewife I see is Tony. Yes. Broken shoulder is healed. That's wonderful, Tony. So glad to hear that. Okay. She says, I realized recently that one of the reasons I've been hesitant to get more involved in groups, etc., is the fear that my life is a total shit show and I will break down in the process. Is this common? So yes, this is very common. People worry about that in the groups, but I'll say a couple things. One, I'm very protective of anybody who's vulnerable. So if you come into these groups and you're having a hard time, first of all, you are going to find these are the absolute nicest people you're going to find. We're all goodists. You couldn't come to a better place to break down. People do break down in these groups. It's a big deal. We have a lot going on. We're dealing with some big emotional stuff. Power column stuff is extremely powerful. There's so much. And meanwhile, you may have been suffering for a long, long time. Listen, it's very common to be worried about that, but what usually happens is it's more that people are judging themselves too harshly. Your life is not a shit show. Your life is like everybody else's. It's hard at times. It has issues. Mine does too. I share about it in the group. We're all in it together. These are very supportive groups. So if you want, though, you can have kind of a side conversation with me so I can help you know what to expect and get more comfortable with it, Tony. I think it would be really great for you, and I'd love to have you. So Stan at crushingdoubt.org. We can talk it over. Laura Court, I see you on Instagram. Good to see you again. And now let's jump back to Diehard Patriot, also known as Joseph. Good to see you, Joseph. He says, hey, Dr. Dan, I have been experiencing erythromelalgia. Like symptoms. I emailed Dr. Schubiner about it, and he thinks, I'm not even going to say the word again, it is a form of TMS. It's supposedly pretty rare. Have you heard of this or seen this? If not, maybe a future TMSer will be helped by this awareness. So, Joseph, let's start with talking about what this is. What is that term? So, obviously, when you ask, have I heard of it? I haven't, or at least not that I'm aware of. So, the very first thing that I'll do, it's very easy to Google just what it is. I wouldn't recommend going to Google what to do about it. But if I want to find out what it is, I Google it. So I'm going to do that right now as we speak. Find out what this is so I can answer your question. Erythromelalgia. Okay. Looks like it is a skin condition. Let's see. Erythromelalgia is a rare condition that causes episodes of burning, pain, and redness in the feet, and sometimes the hands, arms, legs, ears, and face. Symptoms can begin at any age. Some people may have found it from early childhood, while some are only affected as adults. Okay. Glad to clarify that. Now, I wanted to say this. One of the reasons why I sometimes am not familiar with a given symptom is that I don't even care what the symptom is. It's almost always TMS. I don't mean to be a zealot about it, but because the mind and the body can do any of these things, it can all be TMS. If Howard Schubiner has seen you and he thinks it's TMS, that's good enough for me. You've been cleared by one of the best doctors in the TMS world. That means we can treat it 100% as TMS, very gung-ho. I guarantee you that this is TMS. Dr. Schubiner has had a good look at it. This is the kind of symptom, by the way, these rashes, that are very much in line with mind-body. So it will be good to have that awareness. And now I'm going to remember what that is. So thank you for bringing it, Joseph. Let me know if you need more help with that. Molly has a follow-up on the guilt question. She says, I think I felt guilty because I did not want to be useless and feeling vulnerable. Wow. Oh, my God. Molly, I just want to say that I kind of experienced a punch to the gut about that, because what it made me feel was so... I felt sad that you have ever been made to feel that you wouldn't be useful just for being sick. You know, it just shows a lack of care that's been given to you. That's just the way I'm hearing it. You know much more about your life than I do. That's the way I'm hearing it. And I think you can turn that guilt around using the power column, because that's a place where we learn to stop blaming ourselves for things and to start recognizing where we've hurt. So let's talk more about that. Okay, separate question from Joseph. He says, does anyone think stretch marks and keloid scars can be caused by mind-body interaction? I read that cortisol levels are strongly linked to stretch marks. And then he added, Joni, that's crazy, your fingers swelled up. Anything can happen. So let's see, we're having a discussion about this. Let's leave this question up here, but Molly says, I think worriers have more mind-body sensations. People that do not worry just brush it off as it is just as non-threatening. That's true, but now there's a discussion about this. Molly says, I do not think stretch marks are mind-body. I think that has more to do with genetics and someone's skin elasticity. And then Joseph said, cortisol levels do affect skin elasticity crazily. So listen, this is an open discussion. What I would say is I would not be entirely surprised if that is the case. I could be wrong about this, but I remember hearing that there is some correlation between keloid scars and trauma, emotional trauma. So that's interesting. I don't know. It's an open question, but I say we investigate it with science and logic. Let's explore this and find out. Joseph, I'll have to get back to you on that. I'm going to look into it, okay? I'm going to actually add this to preloaded questions so that we do get to it at some point. Give me 1 second. Okay. Molly, with her usual sense of humor, she said, my babies are to blame with my stretch marks. Well, listen, I can guarantee you babies have caused stretch marks for sure. That one, even a man can weigh in on that. Okay, Karen Isaacs, good to see you here, Karen. And she says, I had a headache on my way home driving with my husband the other night. I don't always like his reaction when I tell him. So I took care of me, kept my mouth shut, went home, took a bath, felt fine. So listen, Karen's comment here is it's a good one for us to kind of consider something. I like to say, what's the powerful move here? The powerful move sometimes is to speak up. And the powerful move other times is to say, I'm not going to subject myself to this person's response because they won't get it. And it sounds to me, Karen, like you chose a very good, powerful move for you. It can be lonely. And remember, we talk about this, that people can feel lonely in their recovery. There were times where I wouldn't talk to anybody about this. I would have loved for there to be a forum like this. I would have eaten it up. But that's part of why I'm providing it, because this can be lonely. But we do not have to be so lonely when we've got each other. Okay, now Molly's saying her babies are now 31 and 21. Still babies, right? And then Joseph said, oh yes, Molly, haha, it's not the only cause. Now, Karen has a little follow-up from this. I realized my husband's yelling about traffic is a huge stressor for me. We talked about it. I asked him to please work on it. If he meditated 5 minutes a day, I bet he'd see a difference and chill the F out. Yeah, listen, other people's stress is a big deal. It's part of the work in the power column that we can get to a better place. Molly says, my ex made me feel useless when I was not feeling well, but thankfully he is my ex. Haha. It seems like that was a power move there, Molly, and that's good. It's, I don't like that anybody made you feel useless. I think you're of great use, and you've been of great use even here in your observations. Okay, we're going to finish up on these two comments. Everything else is going to have to go into next week's comments or beyond. Bob says maybe keloid itching or pain could be mind-body. That would be 100% true. Anything with that, I would think, would almost certainly be a mind-body issue. And Joseph says, regarding the erythro blah, 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 haha, Dr. Schubiner mentioned he's seen it before, but there's only one case in the TMS wiki and one case on the other TMS forum. There are indeed rarer forms of TMS symptoms. Yeah, I think that's totally true, but here's the thing to think about. No matter how rare, it doesn't actually matter, because what's happening is the same. The underlying mind-body condition is choosing some kind of symptom that's available. It chooses an available symptom and one that is plausible and believable. So we didn't get to any preloaded questions today, but that's partly because we've got a lot of questions coming in, which I'm glad, because answering questions is the key to this. And I'm excited to be doing this with you. Thank you again. Another reminder, the next seminar is Monday, December 6th. You can get signed up for that. If you sign up for the membership, you get a discount on it. So what I was saying before, when there was that question about what to do, when to join what, don't hesitate. I think, and that was Shannon's question. I would say don't hesitate. Jump in on the membership. You're going to get information you need, and then you can kind of midstream get into the seminar and get that information you need. But both are really important. Okay, guys, we need to wrap up for tonight, but this was a pleasure as always. I look forward to seeing you the same time next week. It's Mondays, 6 p.m. Eastern, 3 p.m. Pacific, and I look forward to it. Thanks, guys. Take care.